falls under the category B, and this is under our initiatives. The grand prize for that was awarded to the City of New York for its work to create the New York City Active Design Guidelines, and these guidelines are part of that city's effort to make their community more user-friendly while promoting a more active lifestyle, and I think the presenter will get into why we need to do that if it's not already obvious. Victoria Milne is with the City of New York's Department of Design and Construction. Victoria?
Thanks. Nice to see all of you here. Just by way of gratitude, I wanted to say how impressed I was with the mission of stewardship. I thought that was very succinct and elegant. I work at the Department of Design and Construction. We have a annual budget of $8 billion a year, which we spend on buildings and roads in New York City. What's forward here? We have been partners with other city agencies and the AIA in New York and some outside academics in developing this set of guidelines called the Active Design Guidelines. And I'm going to talk to you a little bit about where the idea for it came from, and then get into what's actually in the guide, and then what we're doing now and how it's rolling out. It's a project that's got a lot of momentum. So the underlying thing that led us to the program is for several years New York City's Department of Health was doing an annual program with the AIA in New York called Fit City, and it was a program looking at ways that the built environment impacts public health. And in 2006 we got excited about the idea of turning that from talk into walk, in a way, figuring out what can actually be done in the built environment to change it so that it has a positive effect on public health. And in particular, we're interested in this issue. An underlying premise, too, that the historical reference is that in the 19th century, infectious disease was one of the leading killers of people. So that's bacteriological, and a lot of the health conditions that enabled that were addressed through changes in the built environment, like the water system, building codes that introduce light and air and things like that. In our current period, health problems, the major health problems, are coming from obesity and related diseases like type 2 diabetes. Those conditions are obviously coming from lifestyles, not from the environment around you in terms of bacteria. But they are coming from the environment around you in terms of how much you move, what you eat, how you conduct your life. So the underlying idea here is to see what the built environment can do to change those things to address health. By 2030, if obesity trends continue as they are now, 86% of adults will be overweight or obese, and total attributable health care costs will be $860 to $956 billion a year. In Dallas alone, the medical cost of an obese city employee is up to 6 times that of a normal weight city employee. There's a lot of information on how this is affecting America, but it's not only personal costs but social costs as well, which is another reason to take it on. The reason it interacts with sustainable issues in a lot of different ways. A lot of the active design ideas are low cost, and they are synergistic with sustainable goals, like encouraging stair use instead of elevator use, encouraging personal transportation instead of carbon-based transportation. And there's an opportunity to leverage the incentives that exist for sustainable things to cover some of this, not at the expense of the sustainable goals, but in addition. This scary map just shows part of what we're addressing in New York City. We're getting up to 40% obesity in certain areas of the city. And the national map in the U.S. looks pretty similar. This is an example of what we're talking about in the built environment's role. Humans get pushed around by electricity when they could be walking all over the place. And so what's next? I'm not getting next.
Try this one. There you
Okay,
go.
much better.
All right, well, there you go.
Okay, super. Just 2 minutes. So you might be saying, how can climbing stairs and walking a little bit more actually have a big effect? It isn't going to solve everyone's problems, but it is a significant health impact. 2 minutes, about 6 floors of stair climbing a day burns enough calories to prevent, it turns out the bad news is an average adult gains a pound a year. So 6 flights of stairs a day keeps off that pound a year. Men who climb 20 to 34 flights of stairs a week, which is again about 5 flights, have a 29% lower risk of stroke. That having more access to physical activity can result in 25% increase in the number of people who exercise at least 3 times a week. So that's an issue about having availability. And you can read these yourself, but 15 minutes of cycling burns the equivalent of 10 pounds a year. And having a more walkable public realm can result in 35 to 161% increase in physical activity of walking. The point of this is both the impact of the incremental addition of physical activity, but also the reason that having it in the built environment is important, because it's about ease. It's about getting it on your way places. It's about not needing to commit the money and the time to go to the gym, but having this be a part of your daily life and your daily practice. So a year ago we published the Active Design Guidelines, which documents all these strategies. And since then, almost 7,000 copies of the book have been downloaded, and 900 design professionals have been trained in the program. 24,000 stair prompts have been put up in New York City, and people are interested. We worked with a lot of different city agencies to pull it off, so it's Health and Department of Design and Construction, but also working with the Department of Buildings so that the city codes are involved and planning, etc. We also got design professionals involved. And here's the actual substance of it. And a lot of it, as I was saying to somebody earlier, is basically good architecture. You celebrate the stairs. What architect doesn't want to do that? You bring in light. You use more art. You create resources for people walking a little bit more. So the sections are a more in-depth review of the health issues I was talking about, and then a section on urban design, building design, and then synergies with sustainability. In urban design, we talk about the land use mix, parks, play areas and plazas, transit access, and then bicycles and pedestrianizing all of the walking environments. Our next phase, which is going to be significantly challenging, is going to be addressing a less urban environment. So suburban and rural areas, I think, are going to be a challenge, because from New York, it's sort of preaching to the converted. Everybody has to walk in New York. But when you're outside of New York, everyone is much more car dependent. So that's where I think we're really going to have to start thinking a lot, because it's not as clear how to change that. One of the programs has been having a zoning incentive for doing projects with greater access to fresh food, and a lot of things involving bicycle storage, bicycle use, zoning incentives for buildings to incorporate bicycle parking. And in the building design strategies, Again, it's the bicycle parking, recreational programming, using the primacy of stairs in many different aspects. Here are some examples of people having kind of recreation things near their facilities. The center project there is the Cooper Union building by Morphosis in New York, which is very strongly oriented around the stair, central stair. These are examples of kind of stairs as primary circulation. This is the stair prompt that we've circulated, and we found that it actually is effective in getting people. You post them by the elevator, and people continue to use the stairs more even after the thing's been up there for months and months. It's not just like you see it once and you think it's a good idea, but it actually is a continually successful prompt. We had a stair climbing campaign in our building recently. This was our Jolly Stair Encouragement Program. These are good examples of internal circulation in buildings. And a DDC project, which is an enormous NYPD training facility that is going to be applying for our LEED Innovation Credit, which I should talk about. The building is very focused around walking and circulation in all respects. The LEED Innovation Credit is one of the exciting things that we've come out with in the last year, and it is a right now we're trying to encourage buildings around the country to use it. We've got our matrix that needs to be, you need to get 70% of the items for your building, and we're rolling it out under all the rating systems and looking for upgrading it to pilot. So we need to see it used in different building types and different parts of the country. So talk it up. These are our current programs. We're sort of edging from just publishing a book into trying to create a movement. I mentioned the training we've done so far. The Center for Disease Control has given us a grant to mentor 10 other cities in developing these programs in their city. In particular, it's not just doing the strategies, but for a city, being able to coordinate between the different agencies is actually kind of an unusual thing. We've got training programs going on, not only around New York City, but nationally. I mentioned the Innovation Credit. In New York City, we're actually getting in the code changes and the zoning changes that we also want to help other cities and municipalities take on. And I mentioned the zoning and evaluation. Strangely enough, when you're living on grants, you need to have a lot of evaluation to demonstrate the success of what you've been doing. It's an important part of what we've been doing. So we're going to start a center, a nonprofit center in New York that's going to be working nationally on these issues. And we are hoping that the federal government can start to push out some of these issues as well through different programs that they're doing. So thank you for listening.